Okay, welcome and thank you for making time for this session. Today we are looking at assessment of psychiatric patients, and this is one of the key procedures for a student and us to pass through, of course. So that means we have at least to give it some times today. So someone will ask, is it psychiatric or mental health? Well, these two terms can be used interchangeably, but the mental health is much more broader than the psychiatric. So you are justified when you refer to it as psychiatric assessment, right? So we have already looked at health and we have already defined health and we have looked at health at length. But this time we are narrowing down to focus on mental health. So, what's mental health? This is a state of emotional well being which enables me and you to function comfortably within society and to be satisfied of our own achievements. All right, and of course, it's very, very it does reflect the different levels of development. All right, okay, so you must be happy of your achievements. That means milestone. Somebody may be mistaken to think that this is only affecting the elderly population. No, we have different tasks that has to be achieved at different levels, the 8 levels of development, be it the infant, be it the toddler, be it the preschooler, be it the schooler, okay, be it the adolescents, okay. So we can at least have the different developmental milestone and task at this different, okay. You can review the lecture on growth and development to see the different tasks and achievements you're supposed to have at different level. All right, so mental health also refers to the ability of the individuals to be able to carry out social roles and to be able to adapt to the different changes happening in the environment. So when will someone be considered to be having a mental illness? Okay, this disorder is defined as a disorder that affects the psychological or behavioral manifestations or the impairment of functioning due to either social, psychological, genetic, physical, chemical, or biological disturbance. So, for somebody to be referred to as a mentally ill patient, should be have met at least these criteria. Number one, if you are being satisfied with your own abilities and achievements, okay, based on your stage of development, right? Or you're having ineffective and unsatisfying interpersonal relationships for that case, or you're dissatisfied with your place in the world, right? Or you having ineffective coping or adaptation mechanisms, so you lack personal growth. If you fulfill any of these criteria, then you are likely to be suffering from a mental disorder. All right, so guys, our focus today was to know how to assess a psychiatric patient and what is entailed. So guys, we can start by saying that in this psychiatric assessment, what will be the role of the instructor? The instructor will try to evaluate you if you are able to at least know or establish an individual's mental or emotional well-being of this particular patient. So we'll see how you will try to evaluate your ability to provide holistic and patient-centered care, while also demonstrating empathy, effective communication, and clinical competence in this process. So this assessment has threefold purposes. Number one, we want to assess your ability in admitting a patient and providing a safe environment and establishing baseline data for a provisional diagnosis, working diagnosis, and a definitive diagnosis for your patient. All right. Number two, we want you to be able to, we'll assess your ability to establish and assess the physical examination of a mentally ill patients. We also want to assess how you do plan for appropriate interventions, including counseling, individual and group therapy. Lastly, we will assess your ability on checking on the as you take care of your patients, yeah, with different needs. Okay, the needs of course will vary based on the diagnosis, on the working diagnosis, based on the gender and based on the physical features. All right, so patients with schizophrenia are going to be dealt differently with patients suffering from depression, post-traumatic stress disorders. In that case, equally for the gender, the males, the females could be having more additional and precise procedures that are required for their well-being compared to the men. And the physical features, if a patient has a wound, guys, you don't just say this is a psychiatric patient and forget about the wound. We also need to provide some care regarding to that wound, so that we are providing holistic care to this particular patient. So the first part of this assessment will start with planning and organization. And in planning and organization, this is about 20 out of 100 marks, right? So it's quite important. So in planning and organization, it involves two steps where we are going to look at your own preparation and how you have prepared your patient for this assessment. So for your self preparation, we want you to be familiarize yourself with some legal aspect of admission. All right, do know the mental health act in Kenya? We want you to also familiarize yourself on the voluntary versus involuntary admission, and which registers and forms have to be completed during an admission, and equipment. Okay, one of the major tools that we want you to have is the MSA template. Okay, the mental status examination template. So before we even proceed, there are some of these forms that have to be at your fingertips. Number one is MOH 613, and MOH 613 is for a voluntary admission. This is a patient who recognizes that they need psychiatric treatment and therefore they seek admission in your mental health institution. So what do they sign? They sign MOH 613 seeking for your admission in the unit. Okay, this form is also referred to as the voluntary patient. Next, we have the 614, and in 614, we are dealing with an involuntary patient, a patient who is incapable of expressing or unwilling to receive treatment. So here we'll have the caretaker. The caretaker could be the husband, could be the relative, could be the wife, right? So this caretaker is going to sign this form, and in this form they'll be indicating the reasons why they are applying for that particular admission. So when you receive it as a healthcare provider, you're going to sign it, and you're going to sign form 615. So 615 will be filled as a recommendation for the 614. All right, and in this case you are admitting a patient for a period not exceeding 6 months of treatment. However, this one may change, and especially the in-charge may extend this period for up to 12 months, and when they do so, they have to sign the form 6, MOH 616 form. All right? Thank you, guys. So what about patient assessment? That was for self-assessment. Or patient assessment, we'll want to the instructor will be so impressed with you when you are able to demonstrate the four examination techniques: the inspection, palpation, and auscultation where possible, right? They will also want to see you taking the history. Of course, this is the subjective data and is very important in this department. So we want to see you ruling out positive and negative symptoms and providing comprehensive care. Remember, when you are taking the subjective history, we will want you to use more open-ended questions than closed-ended questions. Okay, because open-ended questions gives the patients an opportunity to express themselves, and in the process you are able to pick up one or two aspects of the condition. But for closed-ended questions, patients tend to be more defensive, and as a result, communication will be halted, and this may not be okay for our case. So guys, we have the do's and the don'ts during therapeutic communication. A link will be popping up. You can review that so that you are able to familiarize yourself with the do's and the don'ts of therapeutic communication. So back to the positive and negative symptoms. Of course, we know that the positive symptoms, these are additional behaviors that in a normal person they'll be missing. Whereas the negative symptoms, these are behaviors that in a normal person they'll be present. All right. So in a positive symptom like hallucinations, delusions, thought disorders, movement disorders, disorganized behavior, these are things that are not present in a normal person. All right, but because you are mentally ill, especially schizophrenia, you could demonstrate these symptoms, while the negative symptoms are items that will be present in a normal person. Okay, a normal person, a typical person will have good speech, okay, with range of vocabulary. Okay, they'll have ability to maintain and establish and maintain relationships. Okay, but you'll find for a psychiatric patient they are going to be suffering from social isolation, hence demonstrating social withdrawal. So that becomes a negative symptom. They lose interest, okay, in things that they used to enjoy. Okay, so they have no motivation when they have been demonstrating energy enough for them. Okay, so such becomes negative symptoms. So we could have negative symptoms or positive symptoms. Guys, after planning and organization, we'll move to performance, and performance is one of the key areas in this assessment. All right. So in this assessment, we're going to award this one close to 50% of your score in this case. Okay. So that is 30 plus. Okay, out of 100. So here we want to see you demonstrating ability to conduct MSA, mental status examination, physical examination, of course using the 4 techniques where possible, and carrying out the word round and handing over procedures. Okay, so the examiner will be so impressed if you do so in that organized manner. So in conducting the mental status examination, of course, we will always start with the appearance, where you are trying to look at the grooming, so to assess whether this individual's grooming is either appropriate or if there are signs of neglect. Okay, next we'll look at the clothing, then you can also look at the behavior, and the behavior we're interested in psychomotor agitation or retardation. So we do observe for excessive restlessness or slowed movements, and as they have now repeated movement. So we look for any repeated behaviors such as spacing or handwriting. Okay, one of the commonest behavior that we'll be looking at, and of course it will be seen among these patients, is the echolalia and echopraxia. So echolalia, la 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 la. So we be remembering of the sounds. Okay, so and they normally get these words from authoritative persons in that word, for example. So if the in charge likes to say la la, so every time you hear the patient la 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 la, okay. Whereas echopraxia, they may tend to imitate your movements. Okay, it may tend to imitate your movements for that case. So what does the grooming say about this patient? So if they are well groomed, then we say, yeah, these are, although they may be psychiatric patients, they have a good self-esteem and motivation. Or what about neglect of grooming? They could be suffering from depression, schizophrenia, or severe stress. So changes in grooming habits can signal lack of motivation or energy to engage in self-care activities. What about excessive grooming? So overemphasis on grooming, that is spending excessive time on personal care or engaging in compulsive grooming behaviors, can be associated with anxiety disorders, obsessive disorders, okay, and body dysmorphic disorders. What about changes in, of course, in dress style could lead, of course, could show that there are some sudden changes in clothing choices, would indicate shift in mood and self-perception about themselves. Of course, we could also have lack to attention to grooming, where they wear soiled or inappropriate clothing without regard to the condition. So this could be a sign of cognitive impairment or disorganized thinking. Lastly, we have hair and personal grooming habits. So changes in hair, such as neglect to wash hair or maintaining facial hair in an initial way, could provide additional insight to an individual's mental health status. So changes may be linked to issues such as depression, anxiety, or psychosis. Right? Also, we also look at the speech. So in speech, we are concerned with the rate and the volume. So somebody could be having pressured speech. This is simply rapid, accelerated speech and difficult to interrupt. And this is one of the key behaviors or traits for manic patients. Right? We'll also have slowed speech where these the rate and it's also reduced verbal output and could be seen in patients suffering from depression or Parkinson's disease and other some psychotic forms. Flight of ideas, this is rapid, continuous flow of thoughts with quick associations. And also mania is a condition that where this some will be seen, okay? Tangential speech, this is speech that goes off topic with minimal connection to the main, and schizophrenia patients also demonstrate this. Word salad, these are incoherent speech with jangled or non-essential words, and it's normally demonstrated in patients suffering from severe schizophrenia or disorganized thinking. We have a echolalia that we have just mentioned about behavior. So we have repetition of words or phrases spoken by others, and patients suffering from autism and schizophrenia in some aspects could demonstrate this. Also have mutism, where there's an ability or refusal to speak, and of course it happens in selective mutism and some severe anxiety disorders. We also have clanging, where we speech characterized by rhythmic or sound of words rather than their meaning. Mania could be the problem here. We have also dysarthria, where we have difficulty in articulating words clearly, and this could be related to neurological conditions such as stroke and others. Use of certain medications, okay, that do depress the brain. Okay. Lastly, we have logorrhea. This is excessive, rapid, and often incoherent speech, and mania is the suspect, number one in that case. So as you could also look at the mood, and the mood we are just referring to a more passive and sustained emotional climate, right? Whereas affect refers to a more fluctuating changes in the emotional behavior. Also, we always refer to affect as the weather and mood as the climate, all right? For that case. So according to DSM-4, the affect is momentary, like weather, whereas the mood is prolonged emotion like the climate. Okay, so in a mood we want to know the type or specific mood. Are they happy, sad, are they irritable or anxious for that case? All right, so somebody could be having elated mood, if mood that's euphoria, or depressed mood, irritable, anxiety, dysphoria, apathy, agitation, and flat affect for that case. So the affect, you have the restricted affect, where you observe if emotional expressions are limited, or rapid affect, rapid changes in emotion. Okay, so next we have the thought process. So where we check for circumstantial thinking or flight of ideas or the thought content. So the circumstantial thinking, we evaluate if a person provides excessive detail before reaching the main point, while the flight of ideas, we identify a rapid flow of thoughts that may be difficult to follow, or the thought content, where we are looking do we have delusions, do we recognize fixed false beliefs that are resistant to reason. We could also check for obsessions, not any persistent or intrusive thoughts or behaviors. And lastly, perception, where we are looking at the hallucinations and illusions for that case. So we have different types of delusions, persecutory delusions, grandiose, erotomatic, somatic, nihilistic delusions, control delusions, referral delusions, jealousy delusion, thought broadcasting, and thought incision. Also, types of hallucination: auditory hallucination, visual hallucination, olfactory hallucination, gustatory and tactile hallucinations are, of course, with the disorders that they are likely to present with. On cognition, we are looking at orientation, so where we assess time, place, and person. We also try to evaluate the short-term and long-term memory, and attention and concentration by observing the ability to focus and complete tasks. For the insight, we are worried to see if the patient is aware of their illness and they understand the treatment. So we say either the insight is intact, right, or distorted, right? For the judgment, we provide problem-solving skills. So we assess the ability to generate appropriate solution to problems, okay? And risk assessment. Evaluate if a person can identify a potential risk and make safe decision. So for the application of the nursing process, of course, we are going to look at all the steps of the nursing process, and we have our APAID. So we do assess, we diagnose, we plan, we implement, we evaluate, and we document. So top 5 basic diagnosis in a mental health unit, of course, we have the risk for self-harm or suicide, disturbed thought process, anxiety related to specific stressors such as social situation, phobias, or trauma, ineffective coping related to generalized anxiety and lack of adaptive coping strategies, and impaired social interaction related to social anxiety and fear of judgment are among the most common diagnosis in a mental health unit. As for the Gordon's functional patterns, of course, all the 11 functional patterns are normally affected. So, like the health, first one, health perception, health management. You find individuals with psychosis may have distorted perception of their health, so they struggle with recognizing symptoms or adhering to treatment plans due to altered perception of reality. Health and metabolic, you find some psychosis and some certain medications can affect the appetite of somebody and also the eating habits, so they lead to nutrition imbalances. So you could have weight gain or weight loss, okay, and this normally impacts the metabolic health of a person. Individuals with psychosis also may experience altered bowel and bladder patterns, often related to medication side effects or self-neglect due to cognitive aspect of psychosis. Thus, elimination pattern is also affected. Psychosis, on the other hand, can impact an individual's motivations and ability to engage in regular activity. Sedentary behavior may be exacerbated by medication side effect, affecting the activity and exercise pattern. We could also have disturbed sleep patterns, which are very common with individuals with psychosis. Could be because of the hallucination, the delusions, the anxiety, and this could contribute to these sleep disturbances affecting the overall rest and well-being of a person. So, for the cognitive perception, you certainly find that it's directly affected by psychosis. Individuals will experience impaired cognitive functioning, distorted perception, hallucination, delusions, influencing their ability to process information and also make appropriate decisions. Self-perception, self-concept, role, relationship, sexuality, reproductive, cognitive, stress, value, belief, all these systems patterns are affected for the Gordon pattern. Okay, guys, the other aspect, apart from planning and organization, then we have looked at performance. Then the next is communication. And in communication, we want to see if you have the ability to establish this nurse-patient relationship. You are able to conduct group psychotherapy and you can give a report about a patient. That will be assessed, okay? That will be assessed for this case. So we are interested with the verbal communication, where we're going to evaluate your ability to establish rapport, ask open-ended questions, and actively listen to patient's concerns. And nonverbal communication, we want to assess the use of body language, eye contact, gestures, just to convey empathy and understanding. Lastly, we have now the therapeutic communication, where we look for evidence of therapeutic communication techniques such as reflection, clarification, and validation. Guys, we had already provided the link for this aspect. I hope it should be easier now. Next, we are going to assess your your ability to manage emergencies in the mental unit. Okay, so safety and crisis intervention. We are going to observe your ability to respond to crisis situations, your ability to ensure that safety of both the patients and others, and also assess your knowledge and application of de-escalation techniques. So apart from that one, we look at how you are collaborating with the other healthcare provider. So you evaluate your your collaboration with others such as the psychiatrists, the psychologists, and social workers, nutritionists. We also assess your ability to communicate effectively within healthcare team to provide integrated care, of course, using the S-bar technique. So, lastly, this is about 10 marks. So we are just evaluating your application of theoretical knowledge. So we want to assess to see if you are able to demonstrate knowledge in patients undergoing ECT, electroconvulsive therapy. So how many sessions per week? What are the indications of ECT? Some of the conditions that are highly involved here. Also, how to manage a suicidal patient, right? How to manage a suicidal patient, which drugs are you giving, which type of restraints are you giving for that case. Alcoholic withdrawal delirium, how you are managing alcohol withdrawal delirium. Guys, a link will be popping up the difference between delirium and dementia, right? Okay, next we have acute panic states and how to manage also aggressive and violent patients and acute dystonia for that case. Ladies and gentlemen, one of the key things that we'll keep on interacting with is the extrapyramidal side effects. Of course, these are some of the side effects that are normally encountered as you manage patients using these drugs, of course. So we will want to know, are you able to manage them? Okay, so extrapyramidal side effects are a group of movement disorders that normally occurs as a result of use of medication, particularly the antipsychotic medication. So we have the akathisia, and this akathisia, these are subjective feeling of restlessness and objective increase in motor activity, often manifesting as inability to sit still. Okay, you sit still, so you keep on shaking. While acute dystonia involves sudden or involuntary muscle contractions, leading to abnormal postures and repetitive movements, usually involving the face, the neck, and sometimes other groups of muscles. Parkinsonism simply refers to symptoms resembling Parkinson's disease, which could include bradykinesia, which means slowed movement, resting tremors, muscle rigidity, and postural instability. The tardive dyskinesia is a late onset and potentially irreversible movement disorder characterized by repetitive, involuntary, purposeless movement, often involving the face, the lips, the tongue, and the extremities. And lastly, neuroleptic malignant syndrome. This is a rare but is a severe condition associated with the use of antipsychotic medication. It normally includes symptoms such as hyperthermia, this is high fever, altered mental status, autonomic dysregulation, and generalized muscle rigidity. So guys, you need to be able to manage all of them, those conditions, okay? Especially neuroleptic malignant syndrome, which is an emergency, okay? It's an emergency for that case, all right? Okay. So, lastly, guys, we'll be looking at discharge and follow-up from a psychiatric patient. Okay, so we have said we have to admit a patient for a period not exceeding 6 months, but we can extend it to 12 months, okay, depending on the circumstances. So, but before we discharge them, we have to do clinical assessment, we have to come up with a treatment plan, and we have to collaborate so as to create a supportive environment for the patient ongoing recovery. recovery. Should be done within the legal consideration based on the community resources, and then also plan follow-up and also do patient education for you to have a better outcome for this particular patient. Okay guys, so that is how you're supposed to assess a psychiatric patient, and let's know how you're supposed to do, guys. Guys, if you want to download the or view the checklist, you can go to the description section, you view the checklist for that, and you can also attempt free quizzes regarding this assessment. Thank you and have a great time.